Fall is officially here, and with the change in seasons comes a change in how we should be caring for our skin. Skincare today is about staying healthy, looking natural, and aging gracefully. Yes, please. Joining us this afternoon is Dr. Melanie Palm, a board-certified dermatologist and cosmetic surgeon at Art of Skin, MD in Solana Beach. Doctor, thank you so much for being here.
It's good to see you again, Anna.
Okay, look, you have been talking about, I was reading some of the things from your office about the new trends in skincare. It's a big reversal from what we've been seeing, right? And you actually call it the reversal era.
It is. You know, I think with COVID, people had a lot of time and in some cases disposable income. And I think sometimes there was an overindulgence and unfortunately not some restraint with some of the cosmetic procedures that were being done. And then you saw on social media with some celebrities, little overindulgent filler use. And now happily, I'm seeing a trend go back to like, let's look really beautiful and normal. And I think a big belief in my practice and I think among aesthetics is just wanting to be authentic to yourself. Looking and feeling your best, which I think Southern California definitely is something that's a high priority. And so we're seeing some sort of reversal of some of the filler work that's being done and a trend towards more regenerative technologies where we're harnessing our own body's ability to sort of build ourselves back.
Yeah, I want to talk to you about that. I just had a microneedling treatment with PRP.
Yes.
That's the whole idea behind it.
Exactly.
But let's go back to this. So people, I know a lot of people that are having like their lips dissolved, things like that, and other places that they've had filler dissolved. So how do you find a good injector?
Yeah, I think there's a lot of qualifications. I think first do your research. So I have had a ton of patients find me through ChatGPT. And I love that because I think about starting my practice 14 years ago and I wrote the entirety of our website. And I think, you know, rather than some other search engines where you don't know, is somebody paying for that ability to be on the first page? Is this somebody who's a true expert? You know, ask them. You want to be first and foremost comfortable. Look at a lot of before and afters. Ask them how long they've been doing the procedures. Ask them if they're academically involved. Are they someone like me that researches and am a part of some of the FDA trials that leads to new neuromodulators and fillers and technologies actually becoming widely available in the US? Do they understand complications? Have they ever had one? Because complications happen, but I think true experts know how to handle that. And then what their experience is, you know, how long they've been practicing. You know, maybe somebody's been practicing for 5 years, but it's 1 day a week. That doesn't equal somebody who's been in office 40 hours a week really mastering their plan.
Of course, that's actually really interesting. Are you doing research? Are you researching and staying up to date and current? You're not just, I mean, gone is the frozen look, right?
Yes.
Of Botox making your face freeze. People don't really want that anymore. It's softer.
It is. It should be believable. And, you know, it's interesting. I have a lot of guys that I actually treat for aesthetic procedures. We call it Brotox and Dude Sport instead of sometimes Botox and Dysport. And I think what's important is, you know, there are masculine features if we want to look classically masculine as a male. There are feminine features that make us look more feminine if that's what we're going for. And I think an experienced injector and an experienced provider actually understands some of those nuances because over time we can blur those lines if we're not being clear about what actually fits your face.
And what you're wanting, what you should have too. So your skin is perfect.
Thank you, but I appreciate that.
Dr. Palm's skin. So tell us not just what, we're going to ask you what you, I'm going to ask you what you do, but what is the one thing that we need to do every day?
I mean, it's the obvious answer, right? As a dermatologist, it's wear sunscreen. You know, we're in San Diego and every day about 9,500 people are diagnosed with skin cancer. It's the most common skin cancer. 1 in 3 of us get it. And I think there's a lot of chatter out there, especially on like healthcare podcasts, talking about like go outside and get your vitamin D. Or you need to, you know, stare at the sun for a certain amount of time during the early morning. And I like some of those beliefs within restraint. I know we're living in San Diego. Many of us enjoy activities outside, but I think there's a lot of things that we can do, like wearing a broad spectrum sunscreen, SPF 30 or more. I tend to prefer zinc oxide and titanium oxide or dioxide as the active ingredients. You know, avoid peak sun.
Yeah.
Try and do things before 10 a.m. and after 4 p.m. And use your clothing, UPF clothing and broad brimmed hats, appropriate sunglasses even to protect your eyes.
I love my big hat, always wearing a big hat. What brand do you like of sunscreen?
I love lots of them. So I do act as a medical board advisor for several. I do for Ulta MD, I do for Revision, so that is a little bit of like...
I've used both of those.
Yeah, and I think they're great lines. Ulta MD tends to be sort of a brand favorite amongst dermatologists, but I think looking at the label, so I tend to favor things that have zinc and titanium as the active ingredients. If they're more the chemical ones, which are like polysyllabic and hard to understand, those actually get absorbed into the skin, and some of them get, we can actually see systemic absorption, and they can be possibly endocrine disruptors. So I tend to like mineral-based sunscreens, and even inside, we've got bright lights here in the studio right now. This visible light and the blue light coming off the sun and from all of our devices, it causes pigmentation, so you want to look for a tinted one on your face if you're a female.
I like tinted because then you're not having to run around with makeup on.
Yeah,
too.
you've got a
can
tinted
have it
sunscreen.
Like that. So, okay, let's talk about some of the regenerative.
I know, it's a tough word.
Yeah, am I saying that right? Is that the way that this is going?
It is, and there's a lot of talk about what does that broadly mean, and to me it means we're harnessing our body's own ability to sort of heal itself and enhance itself. So I think there's several categories of things we can do. You mentioned microneedling, which is a mechanical way of stimulating the skin to build collagen. We also do that with laser technology, using heat to harness new collagen growth, and then we can also do topical preparations delivered with some of these technologies to enhance them. So things like growth factors, peptides. You mentioned PRP, which is platelets enriched from a fraction of our blood. All of these things can be used as topical fertilizers to enhance some of the in-office procedures we're doing as well.
What kind of laser, or do they all stimulate collagen?
They do, and it depends, I think, on the person and their downtime. So I'm here in San Diego. We see a lot of sun damage. I see 20s and 30-year-olds that have precancerous spots. So one of the more popular things I start to do in fall and wintertime is multi-light activation photodynamic therapy, which is a way of targeting precancerous spots with a blue light activation. But then we also use something like an IPL photofacial, which is still a way to activate going after the precancer spots, but it clears some of the sun damage and builds the collagen. That has some downtime, though, with it. So I think it depends on the patient. If somebody has a week of downtime, they want the best result. We talk about things like that, or fractionated ablative lasers, which are things like CO2 lasers, erbium lasers. There's lots of brands out there that are those particular lasers. Minimal downtime are things like IPL photofacials to address color, and then things that, lasers that are in the infrared wavelength that help with building collagen over time.
I like that. So how often should you do those? Should you do those like a couple times a year, once a year?
Such a good question. Usually initially, if people haven't had the treatment, depending on their level of sort of sun damage and their desires, we'll do a small series of treatments. It tends to be about a monthly apart. And then after that, I tell patients maintenance. And I think it depends on the person, but we love and we know we can affect the skin microbiome, and we can affect cellular messaging for anti-aging purposes if we're doing it at least once a year, and twice a year is even better.
Oh, that's good to know. Okay, so that's the fountain of youth, is a little laser treatment once a year. Okay, good to know. So if somebody wants to get started, they just need to come in and have you look at their skin, because you don't even know.
Yeah, I think that's, and you know, we're talking and I'm here, but I think for skin experts, a board-certified dermatologist, I think it's very hard to beat. You know, we go through a lot of postgraduate education in order to do that. And I think one that it focuses on aesthetics, we can really talk to you about skincare you do at home, which I think is the foundation. It's something you're doing daily, and I think is some of the easiest ways to achieve really appreciable goals over long term. But we can also pair sort of devices in office, possible injectables, to keep you looking sort of suspended in space over time. I know we've been showing some before and afters.
Yes.
One of my patients is now in her 60s. We show a 12-year result. So she looks younger, 10 years younger in the after, and she's someone that we've just been following over time, and she still looks authentically herself. So,
what has this person had done?
So this particular patient had a little bit of PRP underneath the eyes. This is somebody who's had a treatment underneath their chin to muscle tone and affect what's called the cervical mental ankle. So really improving the profile that we now see in social media. This is a patient that had Bell's Bell's palsy, and we use a muscle toning device, non-surgical, to help
Wow.
this patient. She was told by 2 neurologists that she probably wasn't going to recover. We did a series of treatments, and you can see a much more normal symmetry
Dr.
within
Palm,
her
that's
face.
amazing. Okay, what about
This is jawline refinement, so just a
looks
little bit
great.
of work, and that's how it
It's
should
subtle
be. Subtle,
and
I think, is
beautiful.
where it's key. You know, glowy skin. This is somebody with lots of skin cancers, precancer spots, that we did this photodynamic therapy, improved the sun damage, improved the precancerous spots. I like global approaches rather than reactionary approaches. This is our patient. She's now in her 6th decade. I started when she was in her 40s.
Out.
So I think it goes to show, if you have a real expert and someone who's walking hand in hand with you, we can keep you looking amazing for long periods of time.
That looks awesome, but I want to ask you, the PRP under the eye, somebody just was telling me about that. What does that do?
So PRP, and I do actually more PRF, which is it has a fibrin component to it. So basically, we take a sample of blood, we spin it down. It's faster with PRP, slower with PRF. With PRP, we add additives to get the platelet fraction. With PRF, we have the platelet fraction and we have a fibrin fraction. Both of them have growth factors, and these are like fertilizers for building collagen and elastin in the skin. The skin underneath our eyes is so thin, so if we're able to deliver some of that fertilizer, it helps thicken the skin, help with crepiness. But I do like the fibrin matrix because it has the potential of having some pluripotent stem cells. So that is something that can differentiate into healthy skin cells underneath the eyes.
How often do you have to get that treatment? How long does it last?
Yeah, I think it depends on the person. For most of our patients, we do a series of 2 or 3 monthly treatments, and then it's about once a year we do a single treatment just to keep them happy.
And that just smooths that skin.
Does, yeah.
Oh my goodness. Okay, so you can see I'm writing, I'm taking mental notes. You compare the skin barrier to a cozy sweater, so what do we need to do as we move from summer into fall?
Yeah, I mean, right now we have like Puerto Vallarta weather right now, but we're going to start to see temperatures dropping and lower humidities, and that means transepidermal water loss is greater. So the amount of water we're losing from our skin barrier is greater. We start to get microfractures, we get that itchy winter skin, and then we can actually get eczema or just itchy, what we call asteatotic eczema. So we want to do things to replenish the skin. So look for moisturizers that have peptides, ceramides, things like cholesterol, squalane is really good. We want components that we're sort of building back the integrity of the skin.
Okay, so you really need to be looking at the ingredient list. What should we not be putting on our skin?
I think, you know, everything in moderation. You know, I love retinoids next to sunscreen. That's usually what I have patients use at night in terms of an anti-aging regimen, although we can supplement with other things. But if they're doing too much too quickly, they'll give themselves what's an irritant dermatitis, a retinoid dermatitis. So that's too much of a good thing is not always great. So I think moderation is key with some of the things that we're doing.
You have, let's see, if somebody wants to hit the reset button on their skin health, where should they start?
I think start with talking to a really qualified person. So you want to plan. I think it's completely daunting as not only a consumer, as a patient. I can imagine if I wasn't trained in this area, it'd be really hard. But I think generally speaking, anti-aging, we start with a great sunscreen. We've discussed that. Number 2 is a retinoid or retinoid alternative like bakuchiol. Typically good. In the morning, we love an antioxidant, things like vitamin C, vitamin E, ferulic acid. There's lots of topicals that can be used out there. And then kind of on the top, we start talking about growth factors, peptides, even exosomes, which is a new topical formulation that's being used that has sort of regenerative capabilities.
Okay, that's great. Then do you have a summer event, like the end of summer event?
We do, yeah. We started this with COVID. We do a virtual open house, and it's actually running through the end of this week. And we showcase a lot of the devices and injectables we're doing at the office. So it's called Summer Skin Rescue, as we need after we've been playing out in the sun. And I think it's a great opportunity to talk to us about things like the lasers, the light treatments, helping with things like microneedling. Some of our skincare products are 15% off, and our injectable packages, things like Sculptra, Restylane, Juvederm, those products we offer at a discount as well.
That's a great way for somebody that if you're watching this, then you can go to your website and figure out how to do that. You'll have a link for them there?
Well, we do. It's right on our blog, and it's featured prominently on our homepage.
Okay, we'll put that on CBS8.com. Dr. Palm, I could talk to you all day about this. Thank you so much. This was really interesting and very helpful for people.
Thank you, Anna.
Thank you.